Hi everybody, welcome to week 2. I just want to let you know that I really thoroughly enjoyed meeting all of you last week on the threaded discussion. Sounds like we have a very talented group of nurses, and I'm really excited to move forward and see what type of problems you choose for your evidence-based project. So welcome to week 2. Now, this week we're really going to start taking a look and identifying that problem that we're going to tackle for our evidence-based project. And hopefully all of you looked at everything in the course last week, became familiar with everything in the course, including the projects, the milestones. Also, make sure that you looked at the video last week in lesson 1. We had the beginning identification and second life of a problem, and these are real important videos because they're really taking you through the Johns Hopkins model. So as you saw in Second Life, the avatar was taking a look at medication errors, and so she's really helping you understand how to move through that Johns Hopkins model. So this week we are once again going to be moving through the change process, and we're going to take a look at what our problem is. So this week, as we look at our course outcomes, we're going to develop and outline a scientific, systematic decision-making process to integrate critical thinking with clinical judgment to assure safe and effective outcomes. And so as we do that, moving on to our lesson, we're going to be taking a look at characteristics of nursing practice, and obviously the nursing process, having a professional work environment, partnerships, a caring environment, so we're pulling in nursing theories there, and individualized nursing practice. Now, one of your discussion questions this week is going to be involved with this model, so you can click on it to get more information. And do your readings as well in your book so that you'll be able to answer those questions. So then let's move on now and take a look at those discussion questions. We're going to be looking at forming the PICO question, and also there's that question on characteristics of nursing practice. Now, I do want to just mention again, and I'm going to see, let's see if I can pull this up for you. Just want to talk a little bit as you look at your discussion question this week. I noticed that a few of you lost some points, unfortunately, because you did not cite correctly. Remember that within your discussion question, you must substantiate with both your lesson and your textbook or an outside reading. So there needs to be your lesson as well as your textbook or an outside reading. And you have to make sure that you're using correct APA, so you cite within that discussion using those two sources, and then you reference it as well. So as I grade, just remember that it says up here A, so you want to really make sure that you are answering all of the discussion questions according to this A column, so that you can get all the wonderful points that you deserve. Okay, let's go back here to now launching your PICO question, your PICO question. Basically, you're going to be looking at a problem that exists within your unit or within the facility that you are working. P stands for patient or population or problem. The I stands for the intervention or the treatment that you want to implement based on best practice. The C stands for the status quo or the comparison or what you're currently doing, and the O stands for the outcome. Now sometimes we take the PICO model all the way through T, which stands for time. Is there a specific time frame needed for the intervention? But for your purposes, you're just going to be looking at the PICNO. So for instance, we saw in Second Life there were medication errors, so they were going to introduce barcodes, but there might be something different. Now just remember, as you choose the problem, it needs to be nursing based, not medicine, and it needs to be based on actual data, real problem based on data, because you're going to need to measure an improvement or a reduction in that data in your outcome. And I put some examples in here for you so you can take a look at those. So for instance, newborns of first-time nursing mothers is the P, implementing a mandatory lactation class versus no formal lactation class. Currently on this unit, they don't offer that type of training, and as a result, they have an increase in newborn readmissions. So in this particular question, the question is, in newborns of first-time mothers, does mandatory lactation classes compared to no classes decrease newborn readmissions for dehydration or failure to thrive by 15%? Within 1 month? And again, that's the T piece, but you don't really need to do that for your PICO question. So take a look at this. I gave you another example. Are rehospitalizations high, for instance, for congestive heart failure patients, because they don't have any formal teaching on discharge? So you've gone into the literature and identified that by using teach-back, that can reduce rehospitalization. So you're going to want to formulate then your PICO question. So let's go in now. I want to take a look. Your milestone, your very first milestone, is due this week. So, and it's very important that you get everything done correctly. So as you formulate your PICO question on the threaded discussion, please go back and check. I am going to be really on top of these questions this week, to try to get back with you in a really quick manner so that you know that your PICO question is correct, because everything kind of snowballs and there's a domino effect. I don't want you to have an incorrect question, because then that means that your paper will be incorrect as well. So go back and see what my response is to you, so that you know that you got it done correctly, because then you will get it done correctly for your paper. Okay, so basically your first milestone is due this week, and it's due by Sunday night. And let's actually look at, let's see if I can pull that up. We're going to look at the guidelines here. So you're going to come down and you're going to fill out this worksheet. So what is the practice issue or problem that you've identified? And give me a summary in this particular row of what is going on. And remember, be specific. So it has to be something very specific to your unit that's a nursing issue that needs to be resolved in order to improve outcomes for the patient. So it's patient-oriented. The rest of these are pretty self-explanatory. You can fill in, mark the correct response for that. Here again is your PICO question, which hopefully you've gone back and seen my response to you so that you know that it's correct. And then what evidence are you going to gather? Typically you're going to, now the requirement is that you do a literature review, and you're going to need at least 3 peer-reviewed articles. You can have 4. You have to have a total of 4 sources, but 3 of them need to be peer-reviewed articles, and the 4th one could be some type of clinical practice guidelines, for instance, or something off of a .gov or the IOM, or some .edu, something that's reliable, but definitely not a .com or a Wikipedia or anything along those lines. Then you're going to come down and you're going to complete this evidence appraisal worksheet. So after data collection, you go into the literature, and this is where you do your research. So you're going to complete this column, and you can see, I'll scroll down here, that you have to have 4 sources. 3 of those have to be from peer-reviewed journals. This first column, you're going to put in there the APA formatted reference for the article. So this needs to be correct APA. So I will be looking for, author, initial, date, title of the article, correct capitalization as appropriate, the name of the journal, the title, the issue, the pages, the retrieval. And so basically you want to make sure this is correct. You don't have to worry about indenting the second line as we would in a paper. That might be a little bit more difficult here. I think if, obviously if you want to indent it, you can, but I won't take off points if you don't do that. But you will have to do that for your paper. Then you're going to put in the type of the source. Is it a peer-reviewed journal article? Again, you need 3. Or is it a non-research systematic review? Is it a clinical practice guideline, such as the American Heart Association Clinical Practice Guideline for Congestive Heart Failure, or the ADA Clinical Practice Guideline for Diabetes for 2014, etc. Then the strength of the research. Now you're going to put in here if the evidence is high, good, or low, or if there's a major flaw, and you're going to use the tools on page 238 to 244 of your text to discuss the reasons why you've assigned a particular level of quality here. And so you want to be able to explain that based upon your text and how it evaluates high, good, or low, etc. Now obviously you want to be choosing articles that are high or good for your research. Now, give a brief description of the research. Now, in here, you should give me a summary of this research article. So, more than 3 sentences. I need to see what was the study about, what type of study was it, how does it pertain to your proposed problem, what were the recommendations of the study, how are they applicable to your project. So this piece here needs to be extremely thorough. This column alone is worth 50% of the points for this. So you're going to come down and you're going to do all 4 of those, and you will submit this in the Dropbox by Sunday. Coming back over here to the grading, just make sure you download this and take a good look at this. You're going to get obviously the practice issue and scope of the problem here. Is it thoroughly described? Is the need for change evident? Is the practice area identified? So this is all the PICO. Did you formulate your question correctly? And once again, are your outcomes measurable? So outcomes need to be measurable. That needs to be based on specific data. And then you'll come down here, you can see evidence and search terms. Now, what type of evidence, how are you going to search for that particular issue? Sorry about that. And that just comes off of that very top piece where you were filling out your worksheet. Then you're going to come down to the grading rubric. You can see down here, and I highlighted this, which I shouldn't do because now I can't read it. There we go. So this is basically that A level again, the outstanding or the highest level of performance, and you can see, did you identify the problem? Do you have the question appropriately formulated? And then if you look down here at evidence and search terms, what search terms did you put in to find those research articles? And here's the point value. You can see that the description of the research itself is 50 points. So that is where I was telling you up here, you really want to make sure in that in this one that you've given me a really good summary over here, because that's worth a very high level of points. And I want you all to do really, really well on this project. Hopefully you're going to have a lot of fun with this. So basically, that is it for this week. I'm looking forward to the discussion this week. I'm looking forward to getting your first milestone. And I just want to reiterate that if you're having difficulty with this, or you're just stuck and you just want to talk about it, just feel free to give me a call, as somebody just did. But I promise I will get back with you. I want you to get back on track and be able to identify a real good problem. So we'll work through this in class, but give me a ring if you need to, and I will get you all going in the right direction. So have a great week on the discussion board, and I will look forward to talking with all of you. Take care.